Personal service settings or personal service establishments is something that I and others have been involved with in public health for a long time. There are infection prevention and control guidance that we have for personal service establishments, so it's not quite a free-for-all. There are quite detailed guidance that people need to do. The Beauty Safe online course is one of them, and I was involved in actually setting that up a few years ago, along with a number of other people from industry and from others. So yes, there is some oversight from local public health of personal service settings. Much of them now, given the way that things have evolved in the last few years, are complaint-based. So this is an opportunity for us to reinforce the importance of some of those measures in whether it's a hair salon, a nail salon, a tattoo parlor, all of those places where we get services that can pose a risk of infectious disease transmission. So I think it is an opportunity for heightening awareness across that sector, but they will also have to put in place the measures that we need to prevent transmission of this respiratory virus, COVID-19. So that's over and above the other infection control measures that need to be in place in these facilities or in these premises. So yes, I think it's a good opportunity to reinforce the importance of all of the infection control measures that we have, so that we're not spreading bloodborne pathogens. You know, much of this came out of concerns about HIV and hepatitis and other bloodborne pathogens, skin infections and other things. So there is quite a strong support from public health for these types of premises. I have not considered whether we should take this opportunity to look at regulation again, but I do think it is important in the context that we're moving into that we do put in extra precautions that meet our needs to prevent transmission of COVID-19. Yeah.
Again, as you know, I think the Act, the Barbers Act was one of the oldest acts in BC. It had been around for quite a long time, and there was a deregulation at that time, and the Act was rescinded. But I would say this, that what Dr. Henry is talking about is what everybody is going to have to look at. How do we make adjustments, both to rebuild public confidence, because that would be an important fact, and to ensure there's public confidence to go to establishments should they be allowed to operate in those ways, but also start to do the work now to ensure that it can be done safely. And this is required and will be required across BC society and across the economy. And so there's an issue, and it's important, of the public having confidence, and that will be important for the industry. And the industry will have to see that. There has been a live debate for a number of years within that industry as to what the regulation of that industry should be. But this is an opportunity for that industry to come together, perhaps to raise standards, but what will be required at the very minimum is to meet the standard being put in place by the provincial health officer, which would be the minimum required to start over again. So whether that would require new legislation, I don't know. But with health orders such as we have in place, it will require a dramatic change in the way people operate.